Hello, today's Wednesday, May 26, 2021, and it's Dr. Rhonda Johnson, and today I'm going to be talking about mental health. You know, May is Mental Health Awareness Month, and certainly COVID-19 has had a major impact on mental health here and around the world. Folks have experienced social impacts from this pandemic, loneliness, isolation, a change in their normal social support system, change in their activities and lifestyles, and this is across the age spectrum. People have experienced economic consequences, lost jobs, lost employment, change in their housing. There have been impacts from death of family members. Sometimes multiple family members have died from COVID, and not to mention the grief that comes with that. There's been post-COVID lingering illness. There's been racial trauma. And certainly there's an epidemic of mass shootings here in the United States. Hate crimes are on the rise for specific groups such as transgender people, Asian Pacific Islanders. Addiction experts say that rates of substance abuse and overdose deaths have just skyrocketed. Some experts say this COVID pandemic has been a mass traumatic event. We know that people have experienced profound increases in their levels of stress. Rates of depression have increased significantly, as well as anxiety and sleep disorders. It's clear that we need more mental health services, clinical services, community services, but those aren't always readily accessible. People don't always recognize the signs of mental illness either. You know, everyone's not an expert. Sometimes even depression is hard to miss, and it's often tough to know where to turn or how to get help or how to help people who need help. So I've put together some thoughts around this May is Mental Health Awareness Month. The first thing is we got to encourage people to reach out for help. Now, I'm not a mental health therapist or a psychiatrist, so reaching out for help is very important, be it talking to a therapist, in person or telehealth services, talking to a life coach, a pastor, a friend who you trust. There are crisis counselors that are available, and these services can be free 24/7, 365 days a year. You can text HOME, HOME, to 741-741 to connect with a crisis counselor. There's the National Suicide Prevention Lifeline. That number is 800-273-TALK, TALK, or the numbers are 800-273-8255. There's the Veterans Crisis Line, 1-800-273-8255. And in an emergency, you can always call 911. Other things that you can do to help folks if you're immediately anxious and feeling out of sorts is, number one, get some fresh air. Go for a walk or just start moving. You know, it's time to prioritize your own self-care for mental health. Now's the time to pick up meditation if you haven't done it already. Start journaling. Look up how to do some grounding techniques and practice them. Turn on some relaxing or inspirational music. Start learning how to take deep breaths. There are apps available that you can put on your phone as well. And of course, if your child or teen needs help, please consult their doctors and consult your own mental health care professional if you're already receiving care. I'm going to put some links in this message that have resources. There are a lot of resources available. The bottom line, folks, is that you are not alone. We have to take the stigma out of mental health. There's no shame to having a mental health struggle. 1 in 5 American adults are struggling with mental health illness. So that's my message today. As I mentioned, I'm not a mental health counselor or a mental health professional, but I do care. And May is Mental Health Awareness Month, and I hope you'll take advantage of some of these tools and resources, and please feel free to share this message with others. As always, my views are my own. Stay blessed and take care of yourself.